Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by vascular surgeons Dr. Maggie Arnold, Dr. Misaki Kiguchi, Dr. Melissa Meghpara, and Dr. Danielle Salazar discussing varicose and spider veins. You may have heard about varicose veins, but did you know the difference between them? Stick around to learn about how to identify varicose or spider veins, when it's time to see a doctor, what happens during an evaluation for varicose veins, and the various treatment options we have available at MedStar Health. Before we get into our questions, let's learn a little bit about our experts. I'm going to start this morning with Dr. Salazar.
Hi, I'm Dr. Danielle Salazar. It's very nice to meet everybody. I'm originally from Texas. I did my training in Boston, and I've been in MedStar since 2014. Enjoying vascular surgery.
Awesome. Thank you. And thanks for joining. Dr. Meghpara?
Hi, everyone. My name is Dr. Melissa Meghpara. I did all my medical training up in New York and happily ran away from New York and came down this way. I've been here for a little over 2 years, loving the job down here. I work primarily out at St. Mary's in Leonardtown.
All right. Thank you. And Dr. Arnold?
Hello, everybody. I'm Dr. Maggie Arnold. I am in MedStar up in Baltimore. So I see patients ranging anywhere from all the way up in Bel Air to down in Howard County. I love working with MedStar. I think it's a great organization, and I love the collaboration that we have. I'm so excited to be here with these fantastic vascular surgeons discussing vein disease.
All right. Thank you so much. And Dr. Kiguchi hopefully will be joining us as well. But let's get into our questions. So, Dr. Meghpara, I'm going to start with you. Can you talk about what the difference is between varicose and spider veins? First of all, what are they? And then what's the difference between them?
So just in a very basic term, varicose veins and spider veins are abnormal veins that can really appear throughout life. They are visible veins that are just under the surface of the skin. Varicose veins tend to be larger in size. They tend to be more ropey and tortuous, while spider veins are those smaller veins that kind of branch out from a central point that we see. There's also a vein that's kind of in between those sizes that are called reticular veins.
All right. Thank you so much. How do you tell if someone has varicose or spider veins? Or how can a person tell if they have them?
Yeah, so it can actually be normal to see some veins under the surface of the skin. Those are not necessarily abnormal veins. Or you have a lot of patients who come in thinking about that too. But if you see those like larger, more tortuous veins, they tend to bulge when you have like prolonged standing. These can be an indication of varicosities or varicose veins. The spider veins will appear, however, finer. They tend to be superficial and they branch out, like I said, from a central point. They kind of look like branches on a tree almost. And they appear kind of blue or purple in color.
Okay, thank you.
Karen,
Are
I think, yeah, I was just going to say, I think Dr. Meghpara brings up a really good point because I definitely get a lot of patients who have fairer skin and they have visible veins, but just because a vein is visible underneath the skin doesn't mean that it's a spider vein or a varicose vein. So I think she brings up a really important distinction, and I think that's something we try to explain to our patients for sure.
Thank you so much for that. I agree. Yeah, I definitely have that myself. I can see some veins in my legs and I'm fair skinned. So thank you for making that point. I think that's really important. Dr. Meghpara, are there specific risk factors for either varicose or spider veins?
Sure, yeah. So in general, these veins appear for a variety of reasons. Some we never really know why they pop up, but these things can include like a family history. We have a lot of patients who come in and say, "Oh, my grandmother had them. They were all over. She never had them treated. My mom had them," or things like that. They also tend to pop up in pregnancy. They also tend to also get a little bit better afterwards, but may not completely resolve. Patients who are overweight or obese can also develop these. Patients who have certain types of jobs, which we'll get into, with prolonged standing, and those who have diseases that increase the pressure in their veins.
Okay, thank you. So you mentioned a couple causes, obesity being one of them. Are there other causes of varicose veins?
So in general, anything that increases the pressure in the lower extremity veins can cause varicose veins. And we'll get into this a little bit later with other people, but I think Dr. Salazar is also going to address some of these as well.
Mm. All right, thank you. What about prevention? Is there a way to prevent them?
Yeah, so typically if trying to prevent them, you trying to prevent basically the venous insufficiency, which is kind of the cause of this, and the valve's not working well. So typically things like wearing compression stockings can help at least alleviate some of the symptoms, even though if they don't eliminate the veins themselves. But prevention, you can try to wear compression stockings, and also staying active with exercise or different types of activity can help with this. But like I said before, sometimes it's just family history and genetics, and you're going to be prone to it.
All right, thank you. And aside from the visible changes that you can see in your legs, are there other symptoms of varicose veins?
Yeah, a lot of times patients will actually come in complaining of not necessarily the visible symptoms, but also of heaviness. They can get swelling on their legs and pain over very specific areas, which is kind of where the veins will bulge. And so they'll point out specifically, like, oh, this area bothers me.
Okay. Thank you very much. Well, let's turn to Dr. Salazar. Can you talk about a little bit? We mentioned obesity and certain types of jobs. Can you talk about whether or not there are certain people that are more prone to getting varicose veins than others?
Yeah, sure. I mean, definitely certain professions that have standing or sitting for prolonged periods of time can definitely have increased risk of varicose veins. And then it's a variety of professions that can happen such as hairstylists, cashiers, office workers, healthcare workers, security guard officers. I mean, there's a lot of professions that can kind of risk because they're standing and sitting for so long.
Mm,
So definitely in this population, and over time as we age, it just kind of can progress.
makes sense. Thank you very much. Dr. Meghpara mentioned pregnancy, having that extra weight can be a cause for varicose veins. Are there any other reasons why pregnant women develop varicose veins?
Pregnant women, for the hormonal changes. So I mean, you can even puberty and even menopauses that has hormonal changes affects the vein walls and the valves. So each of those incidents over time can kind of weaken the veins and lead to more progression of the varicose veins themselves. Obviously, women can have any from pelvic surgery, from C-sections that cause scarring, leading to varicose veins, to pressure in the pelvis. There's also other medical conditions, as Dr. Meghpara alluded to, that can, cause varicose veins outside of pregnancy themselves.
Mhm. Okay, thank you. What about medical conditions? Are there certain medical conditions that increase your likelihood of developing varicose veins?
Yes, certainly. So, I mean, we definitely talked about obesity. It's the pelvic pressure putting pressure into the lower legs and the causes the veins to dilate and pull, which progresses and causes skin changes. But you can also have what we call chronic venous insufficiency. So, over time, the veins are basically damaged, and there's prolonged pooling of blood in the legs, and so that can lead to skin damage, skin changes, ulcerations, bleeding from this aspect, and even to a component of disability. You also have some more anatomical things if you're thinking about it in terms of any compression of the pelvis puts pressure into the lower legs. Something we call May-Thurner can cause, after several periods of time, can cause um, swelling and also varicosities in certain populations as well.
Mhm. Okay, thank you. We talked about job functions, but are there certain activities that can increase your likelihood of developing varicose veins?
It's definitely the, standing for X amount of periods of time. So you can imagine if you're hairstylists, standing for hours and hours without kind of a lot of movement or walking that kind of stimulates the calf muscles, or even someone at a desk job from 9 to 5, kind of sitting in the office desk from 9 till lunch, which is about 4 hours or so, and then only break for lunch. So there's a lot of periods where there's not a lot of movement, so there's a lot of pressure into the lower legs.
Mhm. All right, thank you. What about men? Can men have varicose veins too? And is it any less common in men than women?
Yes, men can actually have varicose veins as well. Men do come in to get them checked. Men sometimes though doesn't bother them. They're like, I've had it for years, but someone said my wife said to come, I gotta come see you to get it checked. But it's often not as common as women due to all the hormonal changes we mentioned in pregnancy and menopause. But they can have it up to by age 60. About reported 40% of men can have varicose veins, but it's really about how it's affecting their lifestyle and how big and aggressive they feel that it's bothering their function.
Okay, thank you. That makes sense. Are varicose veins primarily a cosmetic issue, or can they be a sign of something more serious?
So as Dr. Meghpara mentioned, certain varicose veins are usually not dangerous and can be considered cosmetic. Most often the spider veins, we have, small ones that, are not really related. They're visible, but not really causing symptoms. But there's some that can actually be affected that with related to underlying diseases as chronic venous insufficiency that cause enlargement of these varicose veins, that can cause these problems that we discussed of skin darkening, wounds in the legs that won't heal. They're not, as much as you can ambulate, you're not able to function, you're not walking well. And so these can cause a lot of issues that require, more attention. And even, varicose veins, which we talked about, are in the surface of the skin. As they grow larger, they can have clots within themselves, which we call superficial thrombophlebitis, which causes localized pain and can require medical intervention. But what you worry about if this varicose vein with clot can progress to the deeper veins in the leg, which we would call a deep vein thrombosis, DVT, that requires serious medical attention as well.
All right, thank you. Speaking of DVT, can you talk about the relation between DVT and varicose veins?
Well, usually, if there's areas of varicose veins that, are clotting themselves, they can, cause risk to kind of progress clot within the leg. Because superficial veins, the varicose veins, are connected to the deep veins in multiple aspects throughout the leg. And so what you worry about is if there's a recurrence of this pattern, you can have increased risk of deep vein thrombosis. And the larger they get, the larger the risk of you having clot within that area of the varicose vein.
Mhm. All right, thank you so much. We've had a great discussion so far. Thank you to everyone who has joined us. If you're just joining, we are here today with vascular surgeons, Dr. Maggie Arnold, Dr. Melissa Meghpara, and Dr. Danielle Salazar. Dr. Kiguchi was not able to join us today, but we're talking about varicose and spider veins. We have a lot more to talk about. So stick around. If you haven't already, give us a like. Let us know you're watching. Share this broadcast with your friends. And if you have any questions for our experts, please leave them in the comments. We did get one question, which I will ask Dr. Arnold, and we're going to talk to you about treatment next. But the question was, speaking of risk factors and activities, you might get this question a lot, but does crossing your legs cause varicose veins?
I think I get that question maybe once every clinic day. I have to say I don't think so. I think there's a lot of old wives' tales about spider veins and varicose veins. I think people think because you're crossing your legs, maybe you're increasing the venous pressure in that leg. But I like to point out that people get spider veins throughout their legs. So people get them in their thighs, they'll get them at their ankles. I have people who never cross their legs who have spider veins. I cross my legs all day long, and I don't have spider veins. So I think a lot more has to do with just if you're prone to getting spider veins. So I would say if you like crossing your legs, great. I think the most important thing to do is to try to get up and move. So what I tell my patients is your calf muscle is a pump. That's how the blood gets back to the heart. The calf muscle squeezes those veins and pushes it back to the heart. So when you're standing or sitting, your calf muscle isn't doing anything. It's not squeezing the veins. So that's why we encourage people, even if you have a job where you're sitting a lot, to try to get up and move. If you have a job where you're standing, you want to try to move. So if you're a cashier, try to walk around a little bit because you want to get that calf muscle pumping and getting that blood back to your heart. But crossing the legs, I think that's okay.
Very good. That's good to know. I'm crossing my legs right now, so I don't have to uncross them. I'll keep them right
I don't
there.
know. Do you guys tell people differently? Do you think differently? I'd be curious to know what other people think. I get asked it all the time.
No, I think along your lines that, have patients who cross legs with patients who don't, and they still have veins.
They
So
still have the veins.
Yeah,
Yeah.
it's still there. It may make varicose veins a little bit larger, but doesn't change it.
Yeah.
All right. Thank you so much for that input. Let's talk about treatment. Dr. Arnold, what happens if varicose veins are left untreated? Do they get worse? Could they cause any other problems?
So I think Dr. Salazar and Meghpara touched a little bit on some of the problems that can develop with chronic venous insufficiency. But I think they also mentioned the fact that we see patients a lot of times who come into our clinic because their partner or their spouse made them come. They can see the veins, but they're not bothering them. So I think a lot of it really depends on how much it's bothering the patient and how much it's affecting their daily lives. It is important to know that varicose veins aren't going to get better on their own. So there isn't, even if you wear compression, if you have varicose veins, the compression isn't going to make the varicose veins go away. And if you're starting to have symptoms of really significant chronic venous insufficiency where you can get skin changes or even a wound, that's the time to really think about getting medical treatment. Because if you have a wound that's caused by venous insufficiency, the wound healing will be significantly delayed if we don't address the underlying causes. So again, I think it really depends on the patient. And I think that that's what I really like about our practice is that we really consider the patient and their symptoms and their own needs and take each patient individually when we address their varicose veins.
Thank you so much. You mentioned compression stockings. What are compression stockings? How do they work? And does everyone need to wear them?
That's a good question. So compression stockings are just like they sound. It's a sock, basically. Typically, they go up to your calf and they provide a little external compression on the vein. So the big problem with venous insufficiency is that we talked a little bit about the calf pump, and that's getting the blood back to your heart. The reason the blood doesn't move backwards down towards the feet with gravity is all veins have little tiny valves inside of them, and that keeps that blood moving in the right direction. But people with venous insufficiency, those valves break down. We don't really know why. Sometimes they get damaged. Again, sometimes it's just genetic. So that blood moves backwards in the vein, back towards the feet, and that builds up pressure inside of the vein. That increased pressure buildup inside the vein pushes fluid out of the vein. So the idea behind compression stockings is it's going to sort of counteract that pressure. So we're going to give a little pressure on the outside to keep the fluid from getting pushed out of the veins. I think one of the things I try to tell my patients is it can be important to get measured for compression stockings and make sure you're in what are called graduated compression stockings. So those are two separate terms. One, why do you want to get measured? Because if you're in the wrong size, they're really going to hurt when you put them on, or they're not going to do any good. So you can do it yourself. If you Google, measuring for compression stocks, you don't have to go to a special place. It's really easy to take the measurements. But then graduated means there's more compression present at the ankle than there is at the calf. And the reason for that is that's where the swelling happens. And having less compression at the calf also tends to make them more comfortable to wear. So, and again, you can find compression stockings at specialized outlets. You can also get them on Amazon. So you don't have to spend a lot of money to get into compression. Should we all be wearing compression? I think that that's an individual choice, but I definitely work with a lot of patients who wear them. And I also work with a lot of folks in the hospital who wear them who don't necessarily have venous insufficiency, but they feel that their legs feel better and less tired at the end of the day on the days that they wear them.
All right, thank you so much. So if a patient is looking for an appointment, they're looking for guidance for or treatment for their varicose veins, can you talk about what happens during that evaluation?
Sure. So when the patient comes in, the first thing we do is take a history. And that means we go through the patient, we talk to them about what their symptoms are like. What have they been experiencing with their veins? What symptoms have they been having? And how is it affecting their daily life? And then we do a physical exam. And this is really important because not only are we going to be looking at the surface of their skin and looking at the veins, but as vascular surgeons, we always want to make sure that there's not an additional cause. If it's someone's having leg pain, is it because their veins aren't working, or do they have some other problem like arterial disease? And I think that's one of the benefits of seeing a vascular surgeon for varicose veins as opposed to seeing someone who may not be specialized in vascular surgery, because we're going to be able to work up and treat all causes of vascular disease in the legs, both arterial and venous. After that, most patients will get an ultrasound, and that ultrasound is going to be done in our offices. And what we're doing is we're looking for that backwards flow of blood in the veins. So we talked a little bit about those valves, and we want to see, is the blood always going back towards the heart, or does it go backwards through those valves, which could indicate venous insufficiency? And after that, then we talk with the patient about the results of the tests and our treatment recommendations, and we come up with a treatment plan together.
All right, sounds great. Thank you. And you mentioned this earlier, but I think it's important to reinforce, especially when we're talking about treatment and evaluations. But you mentioned spider veins and varicose veins, they don't go away on their own, right?
That's right. Yeah. Unfortunately, there's no even the person who is the most compliant with compression stockings. I think the best you could hope for is you're not going to get more, but it's not going to make the ones that you have go away.
All right. Thank you so much, Dr. Arnold. I'm going to turn now to Dr. Meghpara to talk more about treatment. Can you talk about the treatment options available for varicose veins?
Sure. So it's definitely individualized treatment. There's not really a cookie cutter model for patients. Like Dr. Arnold had mentioned, we want to look and make sure that we evaluate all causes before we start the treatment for varicose veins or spider veins. I also make sure that there's not a deep system reflux as well, so that there's not like Dr. Salazar mentioned, like a May-Thurner's component to this that's going to continue to worsen the varicose veins. And I tend to treat that first before addressing the varicose veins, the more superficial things, if possible. But in general, for varicose veins alone, there's different treatment options that basically revolve around ablating the vein or removing the vein. So there are surgical options, which, things like ligating or tying off the vein, stripping the vein, actually removing the vein itself, or things like stab phlebectomy, where you pull out the vein in pieces. Those are things that are done in the operating room usually, or in an outpatient center. Some places will do that with different types of anesthesia. A lot of times nowadays, though, we do in-office procedures where we ablate the vein either with a laser or a radiofrequency ablation, which are basically different types of catheters that are placed in the vein itself, and basically heat up the inside of the vein to shut it down. The other thing that can be used is a chemical ablation or mechanical ablation, which basically also does the same thing with different ways to address it. And there's a couple of different things on the market which we can use in the office, and there's different efficacies for each of them. But generally speaking, we each have a repertoire of what we like to use, and they tend to be fairly effective. However, there is times where you can still get a recurrence of the disease.
Mm-hmm. Okay. Thank you very much for explaining those treatment options. Are they permanent? It sounds like perhaps the surgical options would be permanent. Can you talk about that?
So I would say there's a caveat to using the word permanent.
Mhm.
Sometimes the treatment can be permanent, as far as like if you're removing the vein, you're removing the whole varicosity, but that doesn't mean that you can't have a recurrence with a new varicosity that develops. And that tends to happen a lot. patients, especially with a very heavy family history, you'll see new veins develop because the body's really good at making new vessels, for good or for bad. So, it also depends on the type of treatment used. Some patients, certain types of treatment work better, like a laser treatment or an RFA ablation, radiofrequency ablation may work better than something chemical like Varithena, which is a foam sclerosing agent that we use. So like I said, the treatment is individualized, and I will pick usually certain treatments for certain patients if I think one might fail more likely than another one. But it's definitely a possibility that the patients are going to develop new varicosities, or even the treated varicosity can basically recanalize or open up again. So we'll re-ultrasound patients afterwards to see if the treatment worked or not as well.
Okay. Thank you. What about after treatment? What can patients expect? You mentioned perhaps reoccurrence, but can you talk through expectations after treatment?
Yeah, so some patients feel better right away, and they'll tell you that. They'll be like, oh, I felt great, like the next day, and things like that. And then there's also like patients will have, there's some expected pain, soreness, you can have bruising after, and you can still have mild swelling afterwards. So we definitely encourage patients to wear compression stockings after the procedure, not just before. Most of the patients, though, I will say their symptoms can be managed with over-the-counter either medication, or stockings. We also encourage our patients to ambulate after treatment, and we don't want them to just be laying around and not doing anything. But I would say, generally speaking, there's some mild discomfort that can happen after these procedures, which generally recover pretty quickly within the week at max.
Okay, great. Yeah, so you mentioned bruising, so that doesn't last very long,
No,
correct?
that bruising will resolve with time. I think some patients get freaked out a little bit with how much bruising sometimes they can have. It tends to be more with the open procedures though, because you're actually breaking the veins and pulling the veins out. So you can have a little bit of a bruising or like a hematoma underneath sometimes. Usually the type of dressing that we do and the type of closure that we use kind of helps to minimize that. But generally what I do is I encourage my patients to, ambulate, wear the compression stockings, and they can use ice to the area to help with some of the swelling.
All right, thank you very much. Appreciate it. Dr. Arnold, question for you. Is there a better time of year to be treated for varicose veins?
So there's not a time of year when it's physiologically better, but I think some people find they prefer to get treatments in the fall and winter when their legs are covered because of the bruising that Dr. Meghpara mentioned. But we will treat you any time of year. But I'd say we're busier in the fall and winter when people are wearing longer clothes and they're not planning on going to the beach. There are a few procedures. Dr. Meghpara mentioned some of the ones that involve small incisions. So if you have small incisions, we would generally request that you don't do any soaking or swimming for at least 2 weeks to allow those incisions to heal. So again, if you had a beach trip planned, it's probably less ideal. But yeah, a lot of patients are not as interested in vein procedures in the summer. We get a lot more influx of patients in the fall and winter.
That makes sense. Thank you so much. Dr. Salazar, is treatment for varicose veins covered by insurance?
Well, coverage may vary depending on your particular insurance plan. Varicose veins are almost often covered by medical insurance when it's deemed medically necessary with underlying conditions such as chronic venous insufficiency is diagnosed, or severe symptomatic varicose veins. So with that medical diagnosis and your ultrasound workup that's done in the clinic, most often it's covered unless it's very specific in your plan. Insurance companies, will not cover treatment if the doctor, if it's considered purely cosmetic, you see it's there, it doesn't bother you, but it's just basically swollen looks, that's considered cosmetic. That's why it's important for your insurance to have claims with a medical diagnosis and a physician's referral for it.
Okay, thank you very much. There is a question from our audience from Karen about treatment and insurance. She asked, do you treat cosmetic spider veins without insurance?
It definitely can be treated. It's considered out of pocket. So, patients can pay themselves for any of the cosmetic spider veins or veins that are not deemed medical diagnosis, but they can pay out of pocket.
Okay. Thank you very much. And another question for you is, or why should patients see a board certified vascular surgeon to treat their varicose veins?
I think, Dr. Arnold kind of touched on this earlier. So a vein specialist may have a board certified qualification, but their titles are really specific to their specific primary field, such as dermatology or cardiology, but they're not specifically trained to treat and diagnose vascular disease. So, many of vein diseases can be easy to treat, but can also become life-threatening if they're left undiagnosed or treated incorrectly. As a result, some patients who never get tested or choose maybe an unqualified doctor can have increased risk of complications that can either worsen your symptoms or even cause lead to a more disability for you. So you want a doctor that is experienced to be able to treat varicose veins beyond just the veins, can also, have a wide expertise in terms of arterial and vascular disease, basically, because you may have more than one condition causing a lot of these problems. So, it's recommended to kind of, be seen by a board certified vascular surgeon so they can, you can get treated with the right diagnosis and such.
I
That makes
wanted
sense.
to jump in on that too. I
Yeah,
think
go for
one
it.
of the things I love also about our group is I think most Venus things are pretty straightforward, but every now and then you come across something that I haven't heard. I mean, I've been doing this for a while, but I'll come across something that I haven't heard of before. And I love this community of vascular surgeons because I have a group of people that I can reach out and talk to about things that, how would you treat this or how would you manage that? And I think for somebody who may be in a standalone practice, they may not have that opportunity to connect with other vascular surgeons with a specialty in venous disease. And at MedStar, we definitely have that expertise. And I think I really value this community of physicians that I can reach out to them when I have questions.
Yeah, also to play off everything, I would say that it's also very important to see a board certified vascular surgeon because they'll also be able to tell you when something does not need to be treated, which is just as important because I have a lot of patients who've been treated and their symptoms didn't get better because that was not actually what needed to be done. And so they had an unnecessary procedure. So I think that's also key.
Great points. Thank you so much. We have another question from our audience. This is from Cookie. Thank you for your question. I'm going to send this to Dr. Salazar because you touched on it a little bit earlier. She asks, is there a way to know if our spider veins are just cosmetic as opposed to a medical problem? I would imagine you would need to see a provider for that, but can you address her question?
Correct. Yeah. So, I mean, spider veins are as superficial, but what we need to do is do a history, full exam. And, part of the workup includes an ultrasound to look at all the veins that, we can't visibly see, with our own eyes and see what may be going on, where this, extra varicose veins or spider veins may be coming from, or what, if there's anything underlying. So, we recommend you come, make an appointment, see us so we can kind of fully evaluate you and check, everything that's may be going on.
All right. Thank you so much. That is all of our questions from our audience and the questions that I have for you today. I'd love to see if you have any final thoughts or what are your key takeaways that you want to make sure our audience is getting from our discussion today. So I'll go around. I'll start with Dr. Meghpara and we'll get your final thoughts before we wrap up.
So I think one of the biggest things about varicose veins to understand is that you need to be able to delineate between what is symptomatic and what's not to understand whether or not it needs to be treated. And I think, like we've mentioned a couple of times, is some patients will just come in to see us because someone else noticed that they have veins that are bulging. And it's most of the men who do that. But it happens all the time. And I think it's very important to be able to have that conversation that, this is the reason that you're having them and whether or not you get them treated. That's totally individualized, and how you treat it is also individualized. So if someone is telling you that, oh, every single one needs to be treated, I would take that with a little bit of a grain of salt because probably not true that everyone needs to be treated. And so I think that that's very important to see, a vascular surgeon to get that opinion from them and really get the evidence-based treatment guidelines.
Great advice. Thank you so much. Dr. Arnold, I'll go to you next.
Thank you, and I thank everybody who joined us today. I want to echo what Dr. Meghpara says. I encourage people, if they have questions, to come in and have a conversation with us. I think sometimes I get patients who maybe are a little scared to come in because they think if they're seeing a surgeon, that means they have to have surgery, and that's definitely not true. Maybe you just have some anxiety about the veins that you're seeing, and you want to make sure that everything's okay. That's also okay. So just because you make an appointment with a vascular surgeon doesn't mean we're going to sign you up for surgery or headed to the operating room. All of us here are here to treat you, treat each patient individually, treat your symptoms, and make sure that the treatment plan works for you.
That's great. Thank you so much. And Dr. Salazar.
I mean, it's easy to echo between both Dr. Meghpara and Dr. Arnold. We work all together in this MedStar health community. So, we treat, a variety of arterial and vein diseases. So, it's not just varicose veins if you think something else may be going on. But, in terms of varicose veins, we go through in depth how it makes you feel, how it affects your daily life, and what is your goal about for treatment. And so we work with the patient individually and try to kind of make the patient feel what they came to get for in terms of our visit.
Great takeaways. Thank you all so much. Really appreciate that. And that's all the questions we have for today. Thank you again to our wonderful experts for being here today to answer our questions. Thank you to our viewers for tuning in. To learn more or to request an appointment, you can visit us online. We will post a link to our website in the comments. And we thank you again. We will see you next time. Bye-bye.